There's unfortunately reason to worry about a new prediction of DFW COVID cases. It comes from UT Southwestern. We say good morning to Parkland Health's Chief Medical Officer, Dr. Joseph Chang. So it's not the college kids and 20-somethings anymore. The biggest increase is the 30 to 50 age group. Do we know why?
Yeah, and it's pretty logical. This is the pattern that we've seen now over our two peaks that we've already had. Starts with the young people go out, mingle with each other, catch the virus, they bring it home and interact with their families, and then it goes from there. So this is a pattern we've seen before, and we're seeing it again, unfortunately, accelerating.
A new UT Southwestern model shows that by the end of next week, and these models are getting, as they should, more and more accurate as we learn more and more about this disease. By the end of next week, Dallas County will have more than 900 new cases every day. Tarrant County, more than 800 new cases every day. That's the black line you see on the graph. We were heading in the right direction. Now it looks like we're not.
No, we're not, and again, it's personal behavior. I've come on here, I don't know how many times, and said the same things over and over. It's personal behavior. Look, our prediction models are getting better, as you say, as they should. But I am still optimistic that if we can control our behavior yet better, that we can affect that prediction. I don't believe that the future is cast in stone. But listen, it is critical for us to understand that as a society, I think we're losing that diligence that we had before. Just one prime example I would point out is a person of influence in the southeastern portion of our country went on news and press conference and said he would like to see 90,000 people packed into a stadium for 4 hours screaming support for his football team, and declared that he was okay with that because their safety protocols were second to none. Well, lo and behold, 20 members of said football team was now positive, and the game is now canceled. I think this is emblematic of sort of the sentiment that is sweeping some parts of our nation, in that we are no longer afraid and we are no longer concerned, and that worries me.
One place we're seeing people gathering in lines to vote. Is that a concern? And I also need to ask you about the Tarrant County Public Health Director saying that he thinks it's time for the kids to go back home and do online learning and to shut down the classrooms.
Well, listen, again, we see that pattern, right, that you had already mentioned, which is to say the young folks were getting it, and now the older folks are getting it. And again, that's because we catch it one place and we take it to another place. As far as the voting lines are concerned in any other places, like say the grocery store or whatever, I've said it over and over, there are safe ways to do this, and we can do that. We all know the safe ways to do these things. We just need to stick with that. It's not that difficult. It's common sense. As far as schools are concerned, we are seeing that for sure. Numerous high school football games have been canceled and or postponed. Numerous high schools, entire schools have shut down and gone back to virtual learning. So I applaud those kind of things. Those are more proactive in trying to prevent the spread. I mean, that's the kind of common sense, again, that we need to all employ.
Yeah, clearly a long ways away from this. I saw the other day some major corporations are saying they don't expect to bring their employees back until maybe a year from now. Dr. Chang, as always, thank you very much.
Yep.